Okay, the next step, let's go down, is to check the thyroid gland. The order of examination is either a part of the whole status examination of the thyroid or just to examine the thyroid gland. Really, the thyroid gland is examined just like any other part in the system examination, and the examination consists of inspection, palpation, percussion, and auscultation. First of all, I will check and inspect the thyroid gland here and to see whether it is enlarged or not, and to see any visible neck that may indicate obstruction. After that, I have to ask the patient to swallow. تبلع لنا رقيق حماده. Okay, حماده شوي مي. If the patient was unable, or for better demonstration, we have to give him or provide him with some water. تبلع لنا رقيق وأنا باوع رقبته. عشتيدك. Because of the attachment of the thyroid gland to the larynx, the thyroid gland will be moved with the deglutition. Absence of this descent may indicate inflammation or neoplasia. After that, really after inspection for the thyroid gland, and we have to ask him to protrude his tongue. If there is any swelling appearing here with the protrusion of the tongue, this may indicate thyroglossal cyst. If the patient wasn't able, or the thyroid gland wasn't so visible, especially in patient who is obese and short neck, we can use Basilos method. حماده بس تشبك الأصابع تخليها على رقبتك وهيك. Okay, عشتيدك. And to see the thyroid gland here, عشتيدك هاي. The next step in the examination is palpation. First of all, I'll palpate for the thyroid gland, pressing from one side and palpate the other side. Also ask the patient to swallow. After that, we have to check the carotid pulsation, if it is in its place or displaced due to thyroid enlargement, and then to detect the trachea and the posterior and the posterior cervical lymph node. This is palpation from the front. After that, I will palpate from behind. Also, I'll press the hand slightly the neck of the patient, and I'll press from one side just like this. I'll press from this side and palpate the thyroid gland from this side. Also, I'll press from this side and palpate the thyroid gland here. Also, I'll ask the patient to swallow. Also, I'll check for the whole remaining cervical lymph node, as we have learned in the general examination. جنحنا شوية عشتيدك هاي. This is all about the palpation from the behind. After that, I'll ask the patient to perform Palpation sign. بس هسه ترفع يديك. Okay, this is Palpation sign. Let's wait. Patient who have retrosternal extension of the thyroid, he will develop cyanosis, congestion, edema of the face with this sign. هاي عشتيدك نزلها. Really, when the thyroid gland became visible and palpable, you have to also to give her or to give the examination committee some characteristics about the thyroid gland in the form of the shape, the size, any lymphadenopathy attachment, that's to say the mobility, whether the thyroid is tender or not, and the consistency. This is about the palpation of the thyroid gland. After that, we have to percuss. In the percussion, we have to percuss the lower part of the thyroid over the clavicles, sternum, clavicle, and upper chest, over the sternum and upper chest. And the dullness here may indicate that the patient has thyroid extension, retrosternal goiter. After percussion, we have to auscultate. The auscultation, you have to look for bruit, which indicate hypervascularity of the thyroid. over both lobes of the thyroid. If breathing interfere with your hearing, you can ask the patient to stop breathing. بس اقطع نفس شوي. عشت ايدك خذ نفس براحتك. هسه اقطعه. عشت ايدك. Really listen for or over both thyroid glands. This may indicate hypervascularity and Graves' disease, and you have to put in your mind that we have other pulsation in the neck in the form of venous hum and also in the form of carotid fluid due to atherosclerosis, and you have to know how to differentiate between them. This is all about the issues and the skills required for the thyroid gland examination.